So, last thing here. This finally gets into the common, sort of research community. Are antidepressants depressogenic on the whole? There's been now a few studies designed to investigate precisely that thing. So what they did here is they looked at people on trials that remitted on placebo versus those remitted on SSRIs, okay? And then these who remitted on SSRIs, I think some of them did then come off, but then they looked at who relapsed in the next 3 months, and you'll see a higher relapse rate in the drug-treated group. So what does he say? And what you're seeing here is some sort of confirmation or some sort of further investigation of this oppositional tolerance idea. Okay? Just so you show that people are actively worrying about this now. And what he's talking about, the more the drug is more power, a more potent inhibitor of serotonergic activity, the more the relapse rate, because it really causes this oppositional tolerance. Here's a study done in the Netherlands. You'll see a longer term, continual AD use, intermittent, no AD use, lower relapse. What does he say? So again, this worry is coming up again in this Netherlands study. By the way, you see it's Canada, Italy, Netherlands, US. It's just not just one. Now this person here, Rifael Malik, works for Eli Lilly as a consultant. So if anybody should be predisposed to see Prozac as helpful, it's this individual. So he went through, in this paper, he went through all this literature, and he's talking about the higher relapse rates. He's also talking about the rise of what is called treatment-resistant depression. At least in his study, he says about 40% of patients on SSRIs long-term become treatment-resistant. In other words, they end up with sort of a chronic dysphoria. So you can read it. And again, it's around this idea of oppositional tolerance. That the drugs are driving people into a subserotonergic state. And by the way, I don't think tardive dysphoria is the same as depression. So depression is, we've all been depressed probably, but when you're depressed, it hurts, right? Depression is painful. It's acute. What he's worrying about really here is more of an emotional numbness that sets in. A lack of ability to really respond to the world. That's what he means by dysphoria. So, now he raises this question. And again, I hope you see that what has happened through this research literature is this concern has arisen about how the medication shape long-term outcomes, and it's rising from a lot of different types of research, an understanding of how the drugs act on the brain, what we're seeing about relapse rates, comparison. There's a lot of research that led to a conclusion that people don't want to make. But you'll see. And see the last part, may not be reversible? I don't think we really know this, but if it's so, you can see why going on a medication may be a very profound thing to do, because it's going to change your brain and maybe it's going to be difficult to ever fully reverse.